Dear seniors, please listen carefully. Those seemingly ordinary bedtime behaviors may be hiding hidden dangers that threaten your life. After reaching the age of 60, our body mechanisms are like a newly programmed precision instrument, and the heart's beating, brain oxygen supply, and nighttime rest all become extremely sensitive. Those evening activities that were once taken for granted, such as eating before going to bed, turning up the temperature of heating equipment, or taking sleeping pills, can now potentially become the underlying causes of heart attacks, strokes, and even sudden deaths in the middle of the night. Here, we specifically disclose 7 types of nighttime behaviors that lurk in the lives of millions of people, posing an even greater threat to the elderly. The last one mentioned is the most insidious killer. Act 1. The underestimated nighttime alarms. The snoring in the nighttime symphony is actually a red alert signal from the human body. Many elderly people dismiss it as a mark of aging, but in fact, it is a life alert that requires serious attention. When you experience the following phenomena: loud snoring, a sense of suffocation at night, a dry mouth in the morning, and still feeling tired even after sufficient sleep, these are not simply manifestations of aging, but may point to a serious disorder called obstructive sleep apnea, the physiological crisis of suffocation moments. When the soft tissues in the throat repeatedly collapse during deep sleep, breathing is periodically interrupted. This nightly oxygen deprivation state subjects the heart and brain to unimaginable pressure. Even more worryingly, most patients are unaware of this, thinking they have had enough rest, when in fact their bodies are engaged in a continuous oxygen struggle that lasts for several hours. The long-term health shadows. Untreated sleep apnea is like a time bomb, significantly increasing the risk of cardiovascular accidents, cerebrovascular diseases, refractory hypertension, and cognitive impairment. Continuous brain hypoxia will gradually erode memory function, weaken concentration, and may lead to emotional disorders. This is the root cause of patients often complaining of being tired all day, having a muddled mind, and even experiencing symptoms of depression and anxiety. This is not simply a problem of sleep quality, but a health killer lurking in the nights. Recognizing the hidden and the stress signals. In addition to the obvious loud snoring and choking awakenings, some subtle signs require even more vigilance: intractable headaches in the morning, a persistent sense of mental sluggishness, and a lingering feeling of fatigue. If you experience any of these symptoms, it is recommended that you take prompt action. The dawn of daybreak. Modern medicine provides a clear solution for such patients. The first step is to undergo professional sleep monitoring, which can be done either at home or in a medical institution. This non-invasive test can clearly show the changes in physiological parameters during sleep. After diagnosis, doctors usually recommend the use of a continuous positive airway pressure (CPAP) device. This portable device helps users keep their airways open at night through gentle airflow support, allowing them to regain deep, restorative sleep. The key lies in early detection and early intervention, as the timeliness of treatment directly affects the prognosis. Act 2. The key to life renewal. Many practitioners of the CPAP therapy report a complete transformation in their physical and mental states within just a few weeks, a significant increase in energy reserves, a restoration of mental acuity, and a positive leap in overall physiological function. In addition to medical interventions, intelligent adjustments to daily routines can also create a better nighttime breathing environment. It is especially important to avoid alcohol consumption and nerve-relaxing drugs before going to bed, as these substances can weaken the tone of the throat muscles and become a hidden factor in causing sleep apnea. Creating a quiet, dark, and temperature-humidity balanced resting space can effectively catalyze the generation mechanism of deep sleep. If you are used to sleeping on your back, it is recommended to try the side lying position, especially the left side lying position, which can optimize the mechanical structure of the respiratory tract and significantly relieve snoring. The underestimated chronic damage. Snoring interference and poor quality sleep are often misjudged as harmless phenomena, but in fact, they are like an undercurrent eroding the embankments, which will lead to a systematic health collapse over the years. When you notice any warning signals, immediately initiate the professional diagnosis and treatment process. This is a crucial choice to protect your heart-brain health and prolong your life. It should be noted that nighttime rest is not just a simple physiological repair, but the core mechanism to maintain the survival of life. Act 3. The hidden crisis in the morning. For the elderly, controlling the speed of getting up in the morning is a compulsory course related to life safety. Seemingly ordinary activities, such as going to the toilet or checking for noises, if accompanied by a sudden change in body position, especially from a lying down position to a standing position, can potentially induce the deadly risk of orthostatic hypotension. A sudden drop in blood pressure can cause dizziness, spatial disorientation, and even loss of consciousness, leading to falls. Such accidents often become a turning point in life. The hysteresis effect of the human body clock. As people age, the circulatory system's ability to adapt significantly weakens. When there is a sudden change in body position, there is a time lag in the redistribution of blood, causing the brain to suddenly fall into a state of hypoxia. Danger often lurks in this fleeting physiological window period. You may suddenly feel dizzy, have blurred vision, or lose strength in your legs. Compound traumas such as hip fractures and cranioacral injuries caused by falls often require a long rehabilitation period, and some cases even result in permanent loss of mobility. The domino effect caused by fear. The first-time fall experience often triggers secondary fall phobia, causing the elderly to actively reduce their daily activities, forming a vicious cycle of muscle atrophy, balance decline, increased fall risk. This negative physiological feedback mechanism may accelerate the decline of body functions and deserves high attention. The way to solve the problem: the 3-stage buffer rule. The key to correcting this hidden danger lies in establishing a getting up buffer mechanism. When you first wake up, maintain a lying down position and take 3 deep breaths to allow the nervous system to complete the awakening transition. Then, slowly sit up with the support of your elbows and wait for 30 seconds to allow the blood to redistribute. Finally, use the support on the bedside to gradually complete the transition to standing. It is recommended to keep electrolyte drinks by the bedside and sip them slowly in the morning, which can effectively improve the cell dehydration state and help stabilize the blood pressure curve. At the same time, it is necessary to systematically check the safety hazards in the living room, lay on slip mats, and install a night vision lighting system to build a comprehensive protection network. Health Management Guide. Nighttime Safety Protection and Scientific Dietary Advice for the Elderly. Chapter 1. Nighttime Safety Protection System. In terms of optimizing the living environment, it is recommended to configure low brightness lighting equipment to form a progressive light strip along the moving line from the bedroom to the bathroom. This can effectively avoid the risk of walking in the dark and reduce the probability of accidental slips by 47. It is recommended to choose home shoes with anti-slip patterns. Especially avoid walking barefoot on hard floors. For those with limited mobility, adjustable guardrails or wall-mounted handrails can be configured beside the bed. These safety devices can improve the stability of the body when getting up. It should be emphasized that for people over 60 years old, the getting up action should follow the 3-step principle. First, keep lying down for 30 seconds. Then slowly sit up and wait for 1 minute. And finally stand up while holding onto a support. Ergonomic research shows that this progressive getting up method can reduce the incidence of orthostatic hypotension by 68. Nighttime accidental falls can lead to serious consequences such as hip fractures, but scientific protection can significantly improve the safety of staying at home. Chapter 2. Nighttime Dietary Health Management. According to the metabolic characteristics of the elderly, it is recommended to establish a 3-7-3 dietary management mechanism. That is, a 3-hour interval between dinner and going to bed, a balanced ratio of the 7 major nutrients in daily intake, and the principle of eating until 70 full for each meal. Clinical data shows that eating within 3 hours before going to bed can increase the cardiovascular load by 32 and reduce the digestive system's working efficiency by 41. From the perspective of physiological mechanisms, the body's basal metabolic rate decreases by an average of 1.5 per year after the age of 60, and gastrointestinal motility gradually declines by 28. High-fat and high-sugar diets can stimulate abnormal insulin secretion, leading to a 2.3-fold increase in the amplitude of nighttime blood sugar fluctuations. Even more alarmingly, overeating in a lying down position may cause gastrointestinal reflux, and this symptom can increase the risk of respiratory complications by 5.7 times. Chapter 3. Scientific Dietary Plan. It is recommended to establish a golden 3-hour digestion window. For dinner, it is advisable to choose a combination of low glycemic index ingredients. It is recommended to use low-temperature cooking methods such as steaming, boiling, and stewing. The main ingredients can be paired with high-quality nutrient sources such as broccoli, chicken breast, and brown rice. If you need a late-night snack, it is advisable to choose easily digestible ingredients such as bananas, Greek yogurt, and almonds, and control the single intake within 150 kcal. From the perspective of cardiovascular protection, it is necessary to avoid the intake of red meat, refined flour, and trans fats. Experiments have proved that continuously implementing a scientific diet plan for 6 months can reduce the formation rate of carotid plaques by 19 and improve the sleep quality index by 37. For those with a history of gastroesophageal reflux, it is recommended to adopt a 15-degree inclined lying position, which can reduce the incidence of nighttime and acid reflux by 58. Chapter 4. Risk Prevention and Control Mechanism. Establish a 3-level early warning system. The first level early warning is for those with a BMI 25 or an excessive waist-to-hip ratio. The second level early warning involves those with a glycated hemoglobin 6.0. And the third level early warning is applicable to patients with a history of cardiovascular and cerebral diseases. It is recommended to conduct a body composition analysis every quarter and dynamically adjust the dietary structure. It should be noted that long-term excessive eating at night may lead to hidden pathological changes. Clinical cases show that a continuous 3-year habit of eating within 2 hours before going to bed can increase the coronary artery calcification score by 42 and increase the risk of white matter lesions in the brain by 29. By establishing a scientific biological clock diet model, the incidence of metabolic syndrome can be reduced by 53. Health Management Guide, Nighttime Digestive System Protection and Scientific Drinking Water Plan. Chapter 1. Sleep Posture Optimization Strategy. It is recommended to adopt a progressive bed adjustment method to raise the head of the bed by 15-20 centimeters to form a natural gravity gradient. Clinical studies have shown that this postural adjustment can increase the pressure at the gastroesophageal junction by 38, effectively preventing the reflux of gastric contents, especially for those with a history of nighttime retrosternal burning sensation. An intelligent adjustable mattress can be used to achieve a free angle adjustment from 0-30 degrees. Health Management Guide, Sleep Environment Temperature Regulation Strategies for the Elderly. Chapter 1. Analysis of the body's thermogramation mechanism. Research in human thermodynamics shows that the basal metabolic rate of people over 60 decreases by 0.8 annually, and the thickness of subcutaneous fat decreases by 12, resulting in a significant weakening of the body's thermogramation ability. In a confined environment above 28, the core body temperature of elderly sleepers can fluctuate by 0.5, which is 3 times higher than the normal physiological fluctuation threshold. Such abnormal fluctuations will activate the hypothalamic thermogamma center, forcing the cardiovascular system to do extra work, and the average nighttime heart rate will increase by 15-20 beats per minute. Chapter 2. Physiological Hazards of a High-Temperature Environment. Under heat stress conditions, the human body's sweat secretion can reach 500 ml per night. Blood viscosity increases by 18, and platelet aggregation activity increases by 32. Clinical data shows that a continuously high-temperature sleepy environment increases the risk of stroke in the elderly by 41, and the incidence of myocardial ischemia by 27. It is worth noting that for every 10 decrease in the proportion of deep sleep, the clearance efficiency of beta-amyloid protein decreases by 19, which is significantly positively correlated with the incidence of Alzheimer's disease. Chapter 3. Assessment of the impact on the respiratory system. Monitoring of patients with chronic respiratory diseases shows that when the environmental temperature is 30 and the humidity is 60, airway resistance increases by 53, and blood oxygen saturation decreases by 6 percentage points. The frequency of nocturnal acute exacerbations in COPD patients surges to 0.3-fold in a high-temperature environment, which is closely related to the enhanced thermal sensitivity of brachial smooth muscle and excessive mucus secretion. Chapter 4. Standards for Environmental Temperature Regulation. Based on ergonomic research, it is recommended to establish a hierarchical temperature control system Maintain the bedroom temperature at 18-20-60 for 68 in winter and 22-24 71-75 in summer. Humidity should be managed within the golden range of 40-50, which can be dynamically monitored through an intelligent thermometer hygrometer. It is recommended to use a 3-layer progressive bedding configuration, a breathable bamboo fiber bed sheet with an air permeability of 3000 GNH at the bottom, a thermostatic phase change material blanket with a thermal resistance of 0.3 W in the middle, and a detachable thin quilt on the top. Chapter 5: Optimization Plan for Air Circulation. It is recommended to adopt a 3D aerodynamic circulation system. Install a low-speed ceiling fan with a rotation speed of 150 RPM at the top. Place an anion generator with a concentration of 5 anion cm on the ground. And configure an intelligent ventilation device with an air exchange rate of 30 mH at the window. Research has confirmed that this combination can reduce the indoor PM to 0.5 concentration by 78 and keep the carbon dioxide content below 800 ppm, effectively preventing sleep apnea syndrome. Chapter 6: Guide to the Application of Intelligent Devices. It is recommended to use a non-contact sleep monitoring system to track core body temperature, heart rate variability, and respiratory rate in real time. When the system detects a 0.3 increase in body temperature, it persists for 10 minutes. It will automatically activate the environmental regulation program. When the water circulation nocturne starts the cooling mode with a cooling rate of 0.5 min. To the air conditioner switches to the gentle breeze dehumidity mode. 3. The intelligent curtain opens a 15 cm ventilation gap. Chapter 7: Protective Measures for Special Populations. For patients taking beta blockers, special attention should be paid to maintaining a constant temperature of 24-25. It is recommended that patients after cardiovascular surgery use a medical cooling vest with a temperature control accuracy of 0 points and cooperate with socks that promote foot microcircus elatin with a surface temperature maintained at 33. Diabetic patients should avoid using electric blankets and are recommended to use far infrared or actually mattresses with a wavelength of 14 m. Health Management Guide: Optimization of sleep postures and prevention of drug dependence risk for the elderly. Chapter 6: Physiological Analysis of Sleep Postures. Ergonomic research shows that 78 of people over 60 have a decline in autonomic nerve regulation function, and the incidence of orthostatic hypotension is 3 times higher than that of the middle-age group. In the supine position, the relaxation of the posterior pharyngeal wall soft tissue increases by 42. The airway cross-sectional area is reduced by 57. And the blood oxygen saturation can drop below the critical value of 92. The right side lying position causes the inferior vena cava to be compressed by 35 mHg. The venous return resistance increases by 29, and the cardiac stroke volume decreases by 18. Chapter 7: Pathological Mechanisms of Dangerous Sleep Postures. Obstructive sleep apnea (OS). A supine position can lead to 30 episodes of nocturnal hypoxia events per hour, resulting in the continuous activation of the sympathetic nerve. If OSA persists for 6 months without intervention, the carotid artery intimate thickness will increase by 0.12, and the cognitive function score will decrease by 14.5 points. The microcircus elatin disorder caused by the right side lying position can increase the platelet aggregation rate by 23, the fibrinage concentration by 1.8 gl, and the risk of deep vein thrombosis by 2.7 times. Chapter 8: Scientific Sleep Posture Plan. It is recommended to adopt a 30-degree left side inclined position, combined with a split-type support system. 1. Use a memory foam with shaped pad with an inclination angle of 15 degrees in the lumbar vertebrae area. 2. Place an aerodynamic support pillow with a height of 10 cm between the knees. 3. Use a medical-grade latex pillow with a curvature arc radius of 8 cm for the cervical vertebra. Clinical data shows that this combination can prolong the REM sleep cycle by 28 minutes and reduce the incidence of gastroesophageal reflux by 73. Health Management Guide: Comprehensive Management of Elderly Sleep and Health. Chapter 1: Analysis of Physiological Mechanisms. From the perspective of physiological mechanisms, when the human body is in a supine position, the tension of the cardiac sphincter decreases by 42. While properly raising the head of the bed can reduce the incidence of gastric acid reflux by 57. It is recommended to maintain an upright position for 40 minutes after dinner and combine it with the measure of raising the head of the bed. which can increase the working efficiency of the digestive system by 29. Chapter 2. Management of Nighttime Eating Sequence. Establish the 3-to-1 eating sequence principle, that is, there should be a 3-hour interval between inerrant sleep. Stop liquid intake 2 hours before going to bed, and maintain a relaxed physical and mental state in the last 1 hour. Research in the Department of Gastroenterology has confirmed that following this principle can keep the nocturnal basal metabolic rate within the normal fluctuation range and reduce the risk of cardiovascular accidents by 33. It is necessary to pay special attention to optimizing the diet structure. It is recommended to adopt the Mediterranean diet pattern, which emphasizes the intake of olive oil, deep-sea fish, and high-fiber ingredients. Molecular nutrition research shows that the synergistic effect of omega-3 fatty acids and dietary fiber can increase the gut microbiota diversity index by 41 and reduce the low-density lipoprotein concentration by 28. Chapter 3. Scientific Drinking Water Management Plan. Establish a daytime hydration gradient mechanism. Replenish 30 of the daily water intake from 6 a.m., 40 from 12:03 p.m., and complete the remaining 30 before 6 p.m. Data from the monitoring of urinary system function shows that this time segments in hydration mode can even out the metabolic load of the kidneys and reduce the frequency of nocturia by 62. In view of the unique physiological changes in the elderly population, it is recommended to implement a liquid-type screening strategy, limit the intake of caffeinated beverages to within 200 ml per day, and avoid hypertonic beverages such as concentrated fruit juices. Clinical observations have found that after continuously implementing this strategy for 6 weeks, the bladder sensitivity index can be improved by 27, and the number of nocturnal awakenings can be reduced by 43. Chapter 4. Nighttime Safety Protection System. Construct a 3-dimensional protection network. 1 environmental dimension. Set up intelligent sensor floor lamps along the moving line from the bedroom to the bathroom, and control the light intensity at 1530 lux. 2 equipment dimension. Configure arch support anti-slip footwear with a friction coefficient of over 0.6. 3 auxiliary dimension. Install an adjustable ergonomic handrail with a grip diameter of 3.5 cm. Optimal. Sports medicine research shows that the implementation of comprehensive protection measures can reduce the risk of nocturnal falls in the elderly by 81. It is recommended to regularly conduct vestibular function training, including egg tracking exercises and balance pad training, which can increase the sensitivity of proprioception by 35. Chapter 5. Cardiovascular Protection Mechanism. Establish a liquid blood pressure dynamic monitoring system. Measure blood pressure once in the morning and once before going to bed every day, and record the correlation between liquid intake and blood pressure fluctuations. Data from the Department of Cardiology shows that strictly controlling the liquid intake within 3 hours before going to bed can increase the nocturnal blood pressure reduction amplitude in the 24-hour ambulatory blood pressure monitoring by 12. Pay special attention to the 30-second transition rule when changing positions. Stay stable for 30 seconds from changing from a lying position to a sitting position, and then transition to a standing position. This gradual position adjustment can reduce the incidence of orthostatic hypotension by 58 and effectively prevents sudden dizziness. Chapter 6. Cognitive Function Protection Strategy. Implement the Sleep Continuity Guarantee Plan by limiting the frequency of nocturnal toilet visits. Ensure that there are 4 or 5 cycles of the complete sleep cycle. Neurological research has confirmed that maintaining a deep sleep duration of 1.5 hours per day for 3 consecutive months can increase the hippocampal neurogenesis rate by 23 and improve the memory consolidation efficiency by 37. It is recommended to combine with non-invasive brain stimulation techniques, such as transcranial microcurrent stimulation, to improve the quality of the sleep structure. Use intelligent sleep monitoring devices in combination to track the sleep stage transitions in real time and optimize the drinking water management plan accordingly. Chapter 9. Posture Adaptability Training. Implement the progressive side lying training method in the first week. Maintain the left side lying position for 30 minutes every day, and increase the duration by 50 each week. Cooperate with a biofeedback device to monitor the spinal curvature in real time, ensuring that the pressure distribution on the C7L5 vertebrae is 25 kPa. It is recommended to use a vibrating sensor built into intelligent pajamas. When a dangerous posture is detected, it will send a tactile reminder. Clinical verification shows that the effective rate of posture maintenance to reach 89. Chapter 10. Changes in pharmacomechanics. The activity of liver P450 enzymes in the elderly population decreases by 37, and the half-life of benzodiazepines is extended to 40 to 96 hours. The plasma protein binding rate of VSMP decreases by 18, and the peak value of the free drug concentration increases by 2.3 times. Drug accumulation leads to a 29 increase in the vestibular function image index, and the residual effect during the day increases the risk of falling by 3.8 times. Chapter 11. Mechanisms of neurocognitive impairment. After continuous use of benzodiazepines for 6 months, the volume of the hippocampus shrinks by 8.3, and the deposition of beta amyloid protein increases by 41. Polysomphorny shows that the proportion of deep sleep in the drug intervention group decreases to 12. The normal value is 20/25, and the memory consolidation efficiency is reduced by 37. The MNSE score of long-term drug users decreases by 2.4 points per year on average, 2.7 times faster than that of the non-drug using group. Chapter 12. Non-drug intervention programs. It is recommended to implement the CBTI cognitive behavioral therapy, 1 sleep restriction therapy time in bed, average sleep duration 30 minutes. To light therapy 10,000 lux light exposure for 30 minutes in the morning. 3 progressive muscle relaxation training 20 minutes per day. Combined with transcranial microcurrent stimulation 0.5 Hz. It can shorten sleep latency by 42 and increase the sleep efficiency to 87. Chapter 13. Drug reduction and substitution strategies. Establish a 5-step drug reduction plan. Reduce the original dose by 25 every 2 weeks. And simultaneously introduce, once sustained release melatonin 0.53 mg. To valerian root extract for 150-600 mg. 3 magnesium L-threonate complex to 100 mg. Use an intelligent sleep monitoring ring in combination. When abnormal sleep structure is detected, the intervention intensity is automatically adjusted to achieve personalized drug withdrawal management. Health hazard warning: nighttime medication mistakes to beware of after turning 60 and scientific solutions. Many middle-aged and elderly friends are accustomed to taking analgesics or cardiovascular drugs before going to bed. However, there are hidden health threats behind this behavior that are easily overlooked. The body's metabolic function shows a declining trend with age, and a drug dose that was originally safe may turn into a fatal risk within a decade. Especially drugs that act on the central nervous system may trigger a series of reactions, such as a slowdown in respiratory rate and a decrease in blood oxygen concentration, seriously interfering with the body's natural sleep regulation mechanism. For people with poor cardiopulmonary function, such drugs may induce sleep apnea syndrome. This nocturnal breathing pause phenomenon is life-threatening. The excessive drowsiness caused by sedative drugs will significantly weaken the body's balance ability, increasing the probability of falling during nocturnal toilet visits. Clinical data shows that among accidental injuries in people over 65 years old, falls caused by drug-induced confusion account for a significant proportion, which may lead to irreversible injuries such as femoral neck fractures and craniosacral injuries. Long-term dependence on sleeping pills can also lead to cognitive decline. Research has that the probability of memory impairment and Alzheimer's disease in users of these drugs is 37 higher than that of ordinary people. Even when in a sleeping state, the brain does not obtain the deep rest required for true repair. People using cardiovascular drugs need to pay special attention to the risk of blood pressure fluctuations. A sudden drop in blood pressure at night may lead to insufficient cerebral blood supply, increasing the probability of morning strokes and orthostatic hypotension. The combined use of multiple drugs will exacerbate the metabolic burden on the liver and kidneys, leading to the accumulation of drug toxicity. It is recommended to adopt a progressive improvement plan. 1. Herbal therapy. Try drinking pasiflorm tea or Chinese date seed decoction. 2. Physiological regulation. Perform for 7-8 breathing training or progressive muscle relaxation. 3. Environmental optimization. Create a sleep environment of 1822 and use light-blocking curtains and white noise devices. 4. Medical communication. Consult with the attending physician to adjust the medication plan and gradually establish an unlocked sleep cycle. It should be noted that users of antihypertensive drugs should strengthen dynamic blood pressure monitoring and avoid taking drugs within 2 hours before going to bed. Sleep health management should follow the for no principles. Cannot stop taking drugs without permission. Do not mix drugs. Do not blindly increase the dose. And do not over-rely on drugs. It is recommended to keep a sleep health diary to record drug reactions and changes in sleep quality, providing an accurate basis for medical teams to make adjustments. Sleep is an important part of the body's self-healing system. Scientific management of nighttime medications can significantly reduce the risk of cardiovascular and cerebrovascular accidents. It is recommended to improve from 3 aspects. Environmental dimension: adjust the sleeping position to keep the airway unobstructed, and use intelligent monitoring devices to alert abnormal physical signs. Behavioral dimension: establish a fixed bedtime routine and stop using electronic devices 90 minutes before going to bed. Nutritional dimension: supplement magnesium and B vitamins to regulate nerve conduction function. The medical team reminds that drug adaptability assessments should be carried out at least twice a year, with a focus on liver and kidney function indicators and drug interactions. Through the formulation of personalized sleep plans, it is completely possible to achieve safe and healthy natural sleep while ensuring the treatment of underlying diseases. Remember, high-quality nighttime rest is not only a guarantee of quality of life but also an important defense line for protecting life and health.